Hi everyone, this lesson is going to review blood vessel anatomy. We're going to discuss the specific anatomy of the tissues found in the blood vessel, how that relates to the job of those blood vessels, how exchange is done in the capillary, and how blood pressure influences that. And then what we're going to do is we're going to connect that all back to COVID-19 and where COVID-19 specifically attacks tissues of the blood vessel. Some of the parts of this lecture were recorded in May of 2020. So in some occasions, you're going to hear me refer to recent events or information and news breaks that were actually the news breaks and recent events of May 2020, but the information overall still holds up. Okay, so, and just reminding you, this is just generally the blood flow from arteries to veins, but arteries, at least arteries that leave the heart and go to the body, are generally oxygenated. Then it must pass through a smaller arteriole to travel to capillaries to deliver exchange of gases and materials and food and nutrients. And then when it returns back to the heart, it travels through the venule back to a vein so it can return to the heart. This is the circuit that basically brings food and gases to the body. Veins and arteries don't necessarily have to be associated with oxygenated or deoxygenated blood. For example, and you'll learn about this later on, there's a separate circuit which brings blood away from the heart to the lungs and provides exchange in the capillaries in the lungs. And then we have this vein bringing blood back from the capillaries in the lungs to the heart. And you'll notice here, instead, my blood is deoxygenated and then receiving oxygen from the lungs. So veins and arteries are more about the direction of blood flow and not whether or not they have oxygen or lack oxygen. And in addition to that, because of the direction they're moving, arteries away from the heart, veins back to the heart, that actually is highly associated with why the walls have the thickness they have and the amount of tissues they have. Okay, the walls of arteries are very thick and the artery itself is large, while the walls of veins are much thinner, though they're still quite large, and capillaries are both very thin in terms of their walls, and they themselves are also very small in terms of diameter. So in terms of the anatomy of the blood vessel, the inside hollow tube here is where your blood passes through, and all your blood vessels have an inside hollow tube for blood flow, because that's kind of the point. After that, then you have the layer that touches the blood. That's the tunica interna, which consists of endothelium tissues. Remember endothelium tissues, the tissues that coat stuff? And because it's meant to kind of create a surface, it's made of squamous endothelial tissues. And that means for the capillaries, it only consists of a single simple layer of squamous tissue, which makes it super easy to have things flow right through the cell and out the capillaries. The tunica media and the tunica externa are the outer layers. So this is the tunica interna, or intima sometimes, the tunica media, and then the tunica externa. If you think about it, interna sounds like inside, internal. Media sounds like middle or medium, so it's the middle layer of the layers of the blood vessel. And externa sounds like external, so it's the outermost layer. Sometimes people call it adventitia. I liked the way I remember it. It's the outer layers that the adventurous people tend to be more out there, but I don't really use that word. I like to stick with externa. But anyways, the tunica media and tunica external are veins and arteries, but not capillaries. So those are the extra layers that help them do their job. Those are the extra layers that allow a little bit of squeezing in the vein and a lot of squeezing in the arteries because it has the muscle for the tunica media, and they also have a little elastic for that squeezing motion, though especially a lot for the artery. And the tunica externa is the reinforcement on the outside layer to provide strength so it doesn't break or anything like that. And it's, again, extra reinforced in the artery because there's so much high pressure going through it. You don't want it to pop. So a little bit extra of that dense elastic tissue to just really reinforce it and keep it strong. So as a quick sketch, if you are drawing this into your notebook or into your notes, what you want to sketch is just a real simple drawing. Easiest way for me is just to use 3 colors so I can distinguish my layers, and then I'll just label a lot. So this inside is lumen, which is where your blood is, or basically where your blood sits. The innermost lining here, that's your tunica interna. The green layer is your tunica media. Which is the layer that has the most variation between the artery and vein because it's extra thick, extra elastic in the artery, and it is not present in the capillaries. And then finally, the outermost layer is my tunica externa. Okay? So just make sure you have kind of a drawing that you can reference, especially for the Actively Learn quiz. So the big deal here is for the anatomy of your blood vessels, the anatomy in particular for the capillaries is ideal for exchange because unlike the vein and arteries, it lacks pretty much almost all the layers. It only has that single tunica interna, that single layer of endothelium cells that allows easy passage of materials from inside the lumen to diffuse and flow out to your tissues. So diffusion, okay? The arteries and veins actually are incapable of exchanging materials because of the density of all the tissues surrounding them, that there is no exchange. So no exchange, just transport. So there's no transportation, there's no exchange between your tissues and your veins, your tissues and the arteries of materials. The point of the arteries and veins is to get stuff from your lung to the tips of your fingers within seconds so that it can get to a capillary, and the capillary is the delivery. And that's why it's there. It's there for delivery. The way it works is when that blood first initially leaves the artery side, the artery and arteriole side into the capillary bed, that blood is fresh. It has the most food, it's the most oxygen rich, and it also has the most blood pressure because it's closest to the heart. So the blood is going to leave and exit the capillary and flow into your tissues, into the interstitial fluid. Then, in that interstitial fluid, as the blood flows through the capillary and it loses more fluid and it also gets further and further away from the heart, it begins to lose blood pressure. And because the blood pressure drops on the side closest to the veins and the venules, it now has the ability to swim back, right? So remember what I said, the arteries, the blood pressure is going so fast. It's like trying to swim against a river that's flowing at 50 miles per hour. You can't do it. But at the vein end of the capillary bed, so you're still in the capillaries, but you're now at the side that's about to enter the veins. At that point, the blood pressure is so low that you can re-enter. So anything that wants to re-enter, especially fluids that are lacking oxygen, fluids that have waste, they're going to diffuse back into the blood because your tissues that have waste, it's going to have a higher concentration of waste. So it wants to go into the blood where there's a lower concentration of waste. And once it gets into the bloodstream, it can then flow around your body to any filter organs and stuff like that. Your blood can flow a little bit back to the lymphatic vessels as well. We'll talk more about that later, and we mentioned it in the past. So you actually have 2 options for blood flow. About 85 to 90% of your, fluid flow through your body. So the fluids in any part of your organs and tissues can either return and get delivered through your blood or through your lymph. Your lymph vessels, because they're lower pressure and they're not nearly as fast, they actually only handle 10% of your fluids. But your blood, because it's so high pressure and so fast and is really built for flow and movement, it handles like 85 to 90% of your fluids in your body. So what you do want to write down is the stuff in this box and the stuff in here. Okay, and maybe you want to write that down, though that is in a future slide. Not in this one, but a future lecture. Okay, so that blood pressure, right? The pressure from this side is what really is the driving force between exchange and flow of blood around your body and delivery to your organs and tissues. It's essential for maintaining the flow of blood around your body. And even though your vein lacks a lot of pressure, it still has some pressure from the heart in addition to the valves and squeezing from your muscles to help push that blood around your body. And you need quite a bit of force to get blood through your body within seconds. And considering the fact that it's moving all throughout your body through very tiny tubes that are very hard to squeeze through and up against gravity when it flows into your brain, that's quite a lot of work and a lot of pressure. And you need to balance it. So it's really important to maintain just enough blood pressure to allow flow, but not so much that you're overfilling, quote, the tire, right? Like if you overfill a tire, it can explode. You basically damage and get damaged. You do the same thing to your blood vessels if the blood pressure is getting too high. That's why when you get real stress, your body is doing a fight or flight response. So it's trying to pump blood through your body really quickly so your blood pressure is getting raised. And you sometimes get a tension headache as a result because you're feeling that pressure of your veins and arteries getting filled up and your capillaries pressing against your brain. So in general, and again, this is generated by the speed of your heart and the force of your heart beats. Now, in the same size vessel, higher blood pressure basically means higher flow. There's a little bit, you need to be careful. Your capillaries aren't necessarily the highest speed, even though its blood pressure is actually sometimes even higher than the veins. But because, you're putting all that pressure through a very tiny straw, it's really hard to get enough blood to flow through it quickly. But in general, again, for the same size of tube, if you put more force into it, it's going to push things through quicker. But like a tiny straw versus a huge straw, tinier straw isn't going to necessarily move faster. Now, when your blood pressure in your body in general is way too low, you're going to not deliver blood as quickly. And in fact, your vessels are a little bit deflated, right? So imagine a tire that's deflated. It's not going to roll around as quickly. So that's what happens sometimes for some of you. If you stand up too quickly, what happens is the standing up creates kind of elastic stretch in your veins and arteries and actually drops your blood pressure. For people who have higher blood pressure, we don't have much issues. But if you're someone who typically has normal blood pressure or even a little bit lower, and this happens more in adolescence, when you stand up very quickly, you might actually get a little bit dizzy, a little bit faint. Your vision might white out, and that's because you have a sudden drop in your blood pressure. You'll get less of that as you get older, because as you get older, you get more stressed and you tend to have higher blood pressure, unfortunately. Very high blood pressure, though, is incredibly dangerous because that constant pressure on your blood vessels will constantly strain them, and with time, it'll create damage in your heart and your blood vessels, which can lead to all sorts of issues in your body. In terms of blood pressure, the number that's on this y-axis is the number that goes on top, and the number that's on the x-axis is the number that goes on the bottom. So in this case, for example, if you're 120 over 80, that's a decent blood pressure, okay? But if you're like in the pre-high blood pressure range, then that doesn't necessarily, it's bad, but you're at a higher risk of eventually having high blood pressure. Now, why is this critical? Well, blood pressure, like I said, it's a fine balance to making sure it's strong enough and high enough to get that good blood flow, but not so high that you get damage. So it's highly regulated. And you're going to keep that homeostasis, that regulation, through two methods, vasoconstriction or vasodilation, generally speaking through that tunica media, that middle layer with the muscle. And what's going to happen, and sometimes the sphincters and other muscles
like teeny tiny muscle and valves around your blood flow. But what they do is they do two things: vasoconstriction, vasodilation. So vasoconstriction, to constrict, is to tighten, right? So it tightens up your blood vessel to stop or slow down blood flow. Because, right, tinier tubes, less flow. Vasodilation opens it up. So when you have vasodilation, right, to dilate is to grow bigger. Your pupils are dilated, they've got huge. They're going to allow more blood flow. So when you get flushed and hot, you are actually undergoing vasodilation to provide more blood flow to the tissue so it can release heat to the environment. And when you get real cold, your fingers get white because you're doing vasoconstriction to prevent blood flow to your fingertips so you don't lose heat from your hands and extremities. Now, why is this relevant to the COVID unit? Well, it turns out the ACE2 receptor that's found on the surfaces of cells is, especially in your blood vessels, is involved in the pathway for blood pressure regulation. And whatever it is, and we don't know the exact reason yet, it may be multiple reasons. If you have chronic high blood pressure, you have a much higher risk of mortality.
Now, what leads to those higher risk factors for COVID-19? Well, many of the things that lead to higher risks of severe COVID-19, not getting it, but having a severe case of it that may lead to hospitalization or even death, that's often associated with having risk factors that cause and put your blood vessels into a vulnerable position. Generally speaking, because the COVID-19 virus specifically uses the ACE2 receptors to attack, and your ACE2 receptors are basically found all over your blood vessels, generally speaking, conditions that result in having lots of ACE2 receptors in your blood vessels and or just having poor blood vessels in general are the things that are gonna often lead to high risk factors of having just a really bad outcome if you get COVID-19 and do not have some sort of immune protection from a vaccine or something like that. And part of that is because your RAS system means your body needs to respond to RAS and other factors to help regulate your blood pressure. And as a result, that means you're just going to have a lot of ACE2 in your blood vessel, because where do you need to regulate blood pressure? In your blood vessels. And if you look at the health risk factors that are listed on the CDC website for people that are at the highest risk for COVID, a lot of these risk factors like older age, diabetes, heart conditions, high blood pressure, obesity, smoking, a lot of them are associated with blood vessel damage. Oftentimes, kidney and liver disorders are a major issue because the kidney and liver just have so many blood vessels in it that when you have a disorder in those things, because so much blood runs through it, if you have blood vessel damage to those organs, they're going to stop working properly, and you can't live without your kidney or liver either. Likewise, cancer is also a big concern because oftentimes the treatments for cancer can lead to blood damage, but also cancer itself also trashes your immune system. So cancer and immune disorders, they can also increase your risk for COVID-19, but for a different reason. Not necessarily ACE2, but just allowing opportunity for more of the virus to enter your body and attack your body, which then can allow more virus to reach your blood vessels, right? Now, in terms of genetics risk factors, there are just some people who express more ACE2 in their blood vessels. And we also know that males are at kind of a higher risk than females when it comes to severe COVID-19 and getting it. We're not 100% sure why, though, because maybe perhaps cultural norms result in more men, for instance, possibly smoking, or there could be a sex-based factor, such as we do know testosterone itself can lead to higher risk of high blood pressure and strokes and clots and other issues in your blood vessel as you get older. Now, one of the interesting things that I kind of put this whole COVID-19 and blood vessels thing in perspective is actually, even though it's somewhat listed as slightly elevated risk, but it's not in the highest risk categories, asthma, if you look at the data, does not present a very high risk of hospitalization or death in COVID 19. In fact, it pretty much, if you look at the data, it doesn't increase your like risk of severe COVID in terms of hospitalization and death. That seems kind of counterintuitive because we know COVID-19 is associated with, not being able to breathe, not being able to get oxygen, stuff like that. But the reason why you cannot get oxygen in COVID-19 is because of your blood vessel situation. However, asthma itself is not due to blood vessels. Asthma itself is due to parts of your lung restricting and constricting, not allowing oxygen to enter due to inflammation, but not necessarily due to your blood vessels having more ACE2 and causing clots, which is what ACE2 and COVID-19 is associated with. So that's kind of one of the interesting things. Now, it doesn't necessarily mean that having asthma won't make COVID especially suck, but it's not associated with higher mortality. And that kind of puts everything in perspective of how much COVID-19 as a virus attacks the blood vessels itself and not necessarily the lungs. The lung just happens to be a target because COVID-19 virus, SARS-CoV-2, travels in the air and your lung is just full of lots of blood vessels.
If you recall, the ACE2 receptor is found on the endothelium of blood vessels, the inside lining of your blood vessel. Now, this is just straight up cribbed from the MedCram YouTube person that I follow. He's a doctor. But I would kind of draw it out myself. Okay, so you have your blood vessel lining, right? And you have the internal lining called the endothelium. Around the endothelium, you have your tunica media and your tunica externa. But that inside lining is the tunica interna, or endothelium. And these are the cells with the ACE2 receptor. Okay? So these are all cells that are prone to potentially getting the virus to attack it. Now, ACE2 receptor is not the only receptor found on these cells. These cells have many ACE2 many receptors besides ACE2, but ACE2 offers an opportunity for the virus to infect it. When the virus infects these endothelium cells, what ends up happening is these cells get damaged. As a result, layers underneath of it in the tunica media and the other layers underneath of the blood vessel create and release clotting factors into the space inside your blood vessel, the lumen. Okay, so the lumen is here, is the hollow inside where your blood is flowing. Okay? Let me try to... The reason why you do that is because when your blood vessel gets damaged, especially in the endothelium, your body thinks that, oh, I must have gotten a cut, I must have gotten a bruise, I need to stop the blood from leaking. So it wants to create clots to help prevent your blood from flowing everywhere. But unfortunately, because the inside lining of all your blood vessels are getting a little bit damaged when you get COVID-19 because of the ACE2 receptors getting attacked, what ends up happening is you're just dumping clotting factors into your blood. And as a result, what's going to happen long term is you're going to get clumped blood chunks. And this clumped blood chunks, normally, if you're bleeding, what they do is they prevent the blood from flowing outside. Okay? But what ends up happening instead, because it's being dumped into your blood that's still flowing around your body, is the clumps, those clots that are being made, end up blocking blood flow to critical organs like your kidney or your brain, and that's how you get strokes. And that's the biggest issue. And it looks like that blood vessel issue, especially associated to blood vessel damage, as well as increased amounts of clots, and which then block blood flow, seems to be the biggest issue related to the symptoms, the really severe, terrible symptoms of COVID-19 in the worst cases. For most people who get mild symptoms, it kind of attacks the ACE2 receptors in your nose, nasal pharynx, and in your lungs, maybe a little bit of your capillaries, but for the most part, it just stays there, and then it goes away, and you don't have long-term damage. But for those people with the most severe forms of COVID-19, what ends up happening is you get that really big, profound tissue swelling in your lungs that can possibly create long-term lung damage. Those clots start to form everywhere, which will then clog and prevent blood flow in critical organs. One of those organs that does a lot of blood flow and has a lot of capillaries flowing through it is your kidney. So it actually turns out for the really severe cases, and this is like 5 to 10% of cases, so not the majority, but for the handful of cases that end up in the ICU, about 20% of those people can end up needing dialysis treatment or treatment for kidney damage. Now again, that's 20% of 5 to 10%, so that's 1 to 2% of overall COVID-19 patients. But that's not, even though it's a minority, 1 to 2% of all COVID-19 patients, that's still a decent amount of people needing kidney help that they wouldn't have needed otherwise. And it means that potentially, even after they're recovered from the disease, COVID-19, they may still need lifelong kidney treatment. Another issue that's happening is strokes. And you're seeing strokes in patients that are very young that you don't expect strokes to be in, people in their 30s to 50s as a result. Those clots can also clog up and block off flow to other tissue besides your brain, like muscles. You're seeing heart attacks, again, because a heart attack is a clot that's preventing blood from going to your heart muscle, so it starts to die. And as a result, you have those issues, so that's a heart attack from COVID-19. And even just overall heart damage, difficulty with your heart, which may lead to lifelong issues or higher risk for cardiovascular disease when you're older. So if you recall, endothelium, and this was from the crash course worksheet, but the endothelium, the tunica interna of your blood vessels, is continuous with the inside lining of your heart. So the heart chambers also have the same tissues, the endothelium tissues that have the ACE2 receptor, so they can be attacked as well by the COVID-19 virus SARS-CoV-2. And you also see some incidents of weird rashes and swelling. So a lot of the really weird issues surrounding COVID-19 that's kind of coming out now that we're gathering more and more evidence of all the people that have COVID-19. There's been some things called COVID toes. So I think I mentioned a while ago where I said COVID doesn't go to your toes. Apparently it can for some unlucky people. Some people get these spidery rashes. There's something called Kawasaki disease, which is these weird patches of rashes that are inflamed and feel like shingles almost on kids. And all of these are related to blood flow issues in the skin, possibly due to blood clotting. So a lot of, not all, but a lot of issues associated with COVID-19 indicate some kind of issue with the blood vessel. So even though we're not 100% on this, more and more of the evidence is building up that some of the severest issues of COVID-19 are directly related to blood vessel and tissues being attacked in the blood vessels, where you can find ACE2 receptors.
So today we went over how structure is so critical to function, particularly regarding the walls and tissues that make up blood vessels. And then we also talked about how that directly relates to COVID-19 and why certain people are at the highest risk of COVID-19 cases that are very severe and may lead to hospitalization or death, and the reason for why that occurs based on what we know of blood vessels. All right, that concludes the lesson. Bye.